Thyroid cartilage.
Thyroid cartilage. Do you see how it looks like a shield, but it doesn't go all the way in the back? So what is this? It goes all the way around.
That's the cricoid.
That's the cricoid or cricoid cartilage, okay? So if you notice, it goes all the way around. So that could be tagged here on the front, or it could be tagged here on the back, cricoid cartilage, okay? These little pointy things here are the arytenoid cartilages, okay? This here is the epiglottis, and these are the vocal folds. Because if you notice, you can pull them and you can actually see how it works, okay? Now there's actually a cat, this one does, okay? So this cat has actually been cut. So if you look here, you can see the epiglottis right here. And the arytenoid cartilages, you can see them right in here, okay? So on this cat, you can see the thyroid cartilage right here, and you can feel, if you run over it, you can feel the ventromedian prominence, which is also called the
Adam's
Adam's
apple.
and right below it, a little bit harder, is where you're going to find the cricoid cartilage. You would have to palpate that to be able to see that it goes all the way around, or you just have to be very careful when you are testing, because that's one of those things that's going to be hard to see. The rest of the trachea is here with all of the C-shaped cartilages going down. You can actually see the individual cartilages, and then behind it, attached here, this is the esophagus, and it's not broken out. For those of you, I have not heard a whole lot of talk about the esophagus today. The esophagus will be tagged on the test. Okay, it will be one of them. So make sure, if I had this here and I had that tagged, what would you be asking for then? The esophagus, even though you
esophagus.
can't see it, but you can see it really well on some of the other cats. You can't
It has
see
been
it
cut
here.
away, yeah.
Yeah, okay. So then, what are we looking for?
Thyroid gland.
So the thyroid gland, anytime we're talking about a gland, we're talking about lobulated or lumpy, bumpy tissue. So sometimes it's harder to see than others, but it is located just caudal, meaning just below the larynx on either side. Quite often, there's going to be a piece of tissue that's connecting the two side to side. So if you can see that, that's what you're going to look for and see if it's there. So right here on this one, I'm assuming that this thing coming right up here is the thyroid gland. So then we're going to look at it a little bit and see if we can see anything that's lobulated. And usually you can see it more on the other side. Can you see how when I make it hard, when I pull it back, can you see how it's kind of bumpy in there? That's a gland, okay? That's glandular tissue. So there's a thyroid gland on that side. And here it is right here on this side. It's actually been torn away. You can see a little bit of it right in there. And then we go down to the thymus gland. The thymus gland is going to be at the lower portion or the caudal portion of the trachea. So you're going to go down as far as you can on that. And you're going to look for the glandular tissue there. And all of this right here is actually the thymus. Okay. The phrenic nerve runs on either side of the heart. Here's one. This is a great phrenic nerve. Everybody make sure you can see that. All the way right there. And you can see it along the side right here as well. Phrenic nerve. Okay? Then we're looking at the lobes of the liver, right? So how many lobes are on the left side?
Are we talking about
Three.
the liver or the lungs?
Sorry, lungs.
It's okay.
It's I don't
It's
know
a-
what it
it's
is
night.
today. I don't know what it is. I'm bad already. I know that that's a issue already. You gotta, but tonight it's really bad. So this is the lungs. How many lobes of the lung are on the left side?
Three.
And so we have 1, 2, and 3. You cannot see the primary bronchus coming down, but like right in here, if I lift up this cat on this side, you can see the trachea. And so I can tell exactly where the bronchus is going to come up. I just can't see it. So when it's coming down and it splits, this is the, what would you call this bronchus?
Primary.
Primary. Now I'm going to go off into the 3 lobes. What would this be?
Secondary.
Secondary. Can somebody get me the sheet block and we'll look at it right now?
Excuse me?